Hi nurses. So in this video, we are going to discuss this question. So the question is, the nurse is caring for a client with liver cirrhosis. What would require immediate follow-up? So before I actually start explaining you this question, I want you to take some time and answer this question and let me know about the answers in the comment section below. Now, let's get back to the explanation. So what I want you to know is that imagine you do not know about liver cirrhosis. Like maybe you are not very well aware of the liver cirrhosis, but you do have a basic idea of what liver cirrhosis is. So this is what the basic ideology of NCLEX. NCLEX does not want you to be like very precise. It just wants you to have a basic knowledge on some things which are very common in the society, because this exam is after all about safety, of you being safe to the public, and this exam is just testing you if you are a safe nurse or no. So I'm going to teach you one important strategy that how can you answer this question even when you have no good knowledge about liver cirrhosis. But before I move into that, there's one more thing that I would like to add on to. The thing is, even if you do not have a good knowledge about it, but you should have a basic knowledge about it. So the basic knowledge includes that the anatomy of liver and what the cirrhosis actually mean. So in the liver cirrhosis, we know this patient is having some kind of liver problem, and then here the liver cells are actually being destroyed. So this is something very basic which you all have an idea of what is going on with this disease condition. Now let us try to solve this answer using just this basic knowledge. So first of all, black terry stool, and another option is bright red streaked stool. Third is light gray clay colored stool, and the last one is small dry rocky stool. Now use your basic knowledge. So the liver cirrhosis, the patient is having liver problem, the liver cells are being damaged, right? Okay, now let's say I have no idea about this answer. Now let us try to figure it out. Let us try how we can go through this question. So let's look at this these options one by one. So the first is black terry stool. We are going to put this option on hold. Second, bright red streaked stool. I know one thing, that bright red means fresh blood. So fresh blood is something which will come with the problem related to hematemesis, when the patient is vomiting out the blood, or it can be any kind of disease condition going on in the body, but definitely not with liver cirrhosis, because with liver cirrhosis, we do not expect the fresh blood to come out of it, right? So since there is nothing related to the fresh blood related to the liver cirrhosis, fresh blood is something which is very fresh, recently bleeding is going on inside the patient's body, which is coming out. So definitely this is not going to be my option, because bright red stool is 100% a no, because this is related to the fresh blood and there's nothing like fresh blood going on in the liver cirrhosis. The patient may bleed, however, but definitely not the fresh blood. So this is eliminated. The next option is light gray clay colored stool. I know one thing, that light gray clay colored stool means there is a presence of fat inside the stool, which is known as steatorrhea, and I know this thing, that this condition is related to pancreatitis. So only if the patient has pancreas problem, he will have light gray colored stool. Now this is something very basic that you should know, that what is going on in which system. Now since this is liver cirrhosis, this is going on in the pancreas, so eliminate it, because this is not related to the liver cirrhosis at all. Then last option is small dry rocky stool. We all are very well aware of that this patient is someone who is having constipation. So this is liver cirrhosis. So this is small dry rocky stool, which is characteristic of constipation. Hence, this option is eliminated. Now I'm just left with one option, black terry stool. Now, black and terry means dark colored, consisting of blood, right? So this is suggestive of melena, presence of blood in the stool. Now, like I said, there might be a problem with the liver condition and the person might be bleeding internally, but definitely it is not going to be the fresh blood. Since it was not fresh blood, we eliminated bright red. However, this is possible that because of liver problem, the patient may have portal hypertension, and because of portal hypertension, he may bleed. He may have esophageal varices, bleeding of the veins in the esophagus, which may lead to black terry stools. So therefore, this is the only one option that is left with us, and this is the only one which is being correct. So that's how you can solve your questions if you have an idea about basic things in NCLEX. So if you really found this video to be helpful, please let me know in the comment section below, and we'll try to bring up such videos more in future. Thank you so much.